Hey, Jeff.
Oh, hey, what's up?
How's it going?
I'm doing good. How are you?
Good. Look, I'm getting a workout. You want to join me?
Let's go.
He's ready. Hey, everyone. Welcome to Workout Buddies. My name is Kelsey Heenan, and today our buddy is the one and only Jeff Wiegers. Jeff, welcome.
Thank you. Glad to be here.
So excited. Jeff is a new buddy. We just met, and I'm so excited because he's legit. We have so many things that we're going to talk about, and we have a really great workout plan for you today. So you're just going to need dumbbells, and we're going to do a lower body push into an upper body push, and then we have a little finisher at the end. So it's going to be super fun. We're going to move quickly. And again, you can always move at your own pace. If you need to rewind something, do it again, then that's great. So are you ready to get warmed up here?
I'm ready.
Okay, perfect. Let's start here just with a squat to stand. We're gonna be doing a lot of squatting today. So we can just face forward right here, feet about shoulder width apart. Just reach down towards the toes. Here, just kind of move the hips from side to side. Feel that in the hamstrings. Keep your hands here and then move your hips down into a deep, look at, you can deep squat, sir.
I'm keeping up so far, okay.
Oh my gosh, I love that.
Rustier than it looks.
Keep your hands down, move the hips up. Again, just kind of move side to side. And then bring the hips down. And we'll do this 3 more times. And then move into the next portion. So, Jeff, tell us a little bit about who you are and what you do, because you're fascinating.
Okay, well, I'll take that.
Yes.
I am primarily a doctor at this point. I'm an anesthesiologist, and I am fellowship trained in pain management. So the way to think of that one is when people get knee injections, shoulder injections, back injections, I do all that sort of stuff. But more relevant, I've gotten into the regenerative medicine space, which is kind of a blurry term for longevity, health, functional medicine. Really, the theory is just looking at things from a root cause, doing anything to help the body heal itself as opposed to intervening artificially. Interesting.
That's incredible. Let's move into here. We're gonna go into a half kneeling position.
All right.
Give me a bit of a forward lean. Just feel that stretch out the hip flexor there.
Oh yeah.
And then reach back, sweep towards the heel. And then we'll just oscillate here for a few. Okay, so you get up in the morning. What's your typical day right now?
So I work in a regenerative practice. I say we treat really 3 groups of people. Okay. One being sports medicine. So right down this is like our thing, younger athletes, people that get injured. We work with them and we use things, people have probably heard of PRPs, or now words like peptides are starting to be buzzwords. We're involved in that space. Group 2 is longevity health. So the way I think of that is people that are already doing a lot of things well, and we're just trying to optimize or push it further. This is, there's a lot of, the technology's developed a ton in that space. And then number 3, we call complex illness, just as a catch-all term. I would call this, anything that's, usually it's things that are being missed by the traditional system, but your things like Lyme disease, mold, microbiome, all the functional medicine stuff where we're deep diving on diet, environment, exposures. That's kind of our 3rd bucket. But a day is clinic. We're very much concierge based.
Okay.
So lower volume, but we're more of, I say we're like the Sherlock Holmes of medicine. We do a lot of deep dives on people's health, and we're doing labs that are really, really advanced to look in every system, how everything's working. And there's a lot of new things happening on the edges of medicine. So that's us.
Wow. So, okay. So who would you say are like your main clients? Like they come in with what type of like symptoms or presentations, and maybe they don't know what's happening?
So we definitely work with NFL, NBA. Okay. Some of these ones. Those people are more one and done.
They have an injury specifically and you help them?
Yes. Okay. Yeah, like the Achilles heel thing in the NBA this past season was a huge one.
We lost Tatum, we lost Halliburton.
Yes.
And now I'm blanking on the last one. There was one in the finals. There was another one. But regardless.
Yeah.
Wow.
But that's a big one. There's a lot of things there. People are looking at, can people use things like stem cells, exosomes? People know the story of Kobe going to Germany, doing stem cells. It's come a long way since then, but that's certainly one of our alleys. Then beyond that, we get a lot of people that are just kind of lost and don't know what's wrong with them. And they've been told, you're healthy, or it's just in your head, it's anxiety, these sorts of things. And as you can imagine, most of the time we end up finding things. And so we treat all those.
Okay, one thing that I saw on your page recently was, we'll do one more here. You said, a lot of times people come to you and they say, I feel like there's something wrong. Mm-hmm. And a lot of times you said they are correct. And I was so impressed by that, because Stacy, a friend, and we'll stand, Stacy, who's a friend, just came in and her sister had cancer, and she kept being turned away and saying that nothing was wrong. And so to hear you, a physician, saying, listen to your body is so powerful.
Yes, you hear that all the time, that I know my body. Is I think the phrase I was quoting there. I'm following you.
We'll just do some hip openers here, and then we'll get going. Alternate external rotation. Yep.
But that's a very real thing. And being in pain management, you'd be in the hospital a lot. And I think one of the most common ones, I'll actually speak a little on the breast cancer thing and what's going on there. That's an epidemic in and of itself. But we would see a lot of people come in and just have abdominal pain. There's just abdominal pain, and they'd get these cramps or whatever. And they usually had a little bit of an idea that, I think it happens when I eat this thing, or that medication's definitely a no-go for me.
Interesting.
There's a lot of body wisdom, and we talk about people being body aware. Mm-hmm. Some people are really in tune, and they know. But what I found as a general principle is they're usually right, and they're usually trying to tell us as doctors, you're not totally piecing it together here.
Interesting.
And we can find a lot of those things now through, microbiome testing or whatever it is, deep lab panels.
How encouraging to first of all, have kind, empathetic doctors, and science is now, we're now discovering things where we can be able to treat things more quickly.
Totally.
And also that people have an awareness of their bodies and feel safe to trust themselves.
Yeah. I mean,
I'll have you grab that weight.
Okay, let's go.
That's so amazing. Okay, I'm gonna tell us what we're doing, and then we're gonna roll through it, okay? So the first one we're gonna do is a goblet squat hold. So you're gonna hold for the same amount of time that Jeff and I hold it, and then we're gonna go into 10 goblet squats into 10 squat jumps. So we'll quick demo here. We're gonna hold the weight here. Firm grip on the dumbbell, below your chin, shoulders are rolled back. We're gonna initiate the movement by bending our knees, putting our hips back, keeping our chest nice and tall, and we're gonna hold here. After our hold, we're gonna come up, and we're gonna go right into 10 goblet squats, keeping it moving here. Okay, and then we're gonna go put the dumbbell safely to the side, out of the way, and we're gonna load up into squat jumps. If jumping doesn't feel good for your body, you can keep it low impact by just going up to your toes. Keeping it dynamic, keeping it athletic, but keeping your toes on the ground. Sound good?
I love it. All three, just.
We're gonna go back to back to back, and then we'll take a rest. Okay, we'll do that twice. Okay, so we'll grab the dumbbells here. Okay, so continue what you were saying. We're gonna just go into a hold and hit it right here. We'll go 30 seconds here. So you were saying something about breast cancer and...
Yes, I mean, the toughest thing about this one is it's more females that are the victim. And estrogen is a super fragile hormone, and unfortunately it gets more damage, those systems, than the male end of things.
Yeah.
And women are exposed to breast cancer, men, we dodge it. Uterine, ovarian, all these.
I know. Ooh, and you're talking the whole time. Let's get 10 goblet squats right here. I'll count. Yes. Okay, so the women are...
So women are more at risk in general, and you look at those rates and they're rising for sure. And it's a few things. I mean, some people will talk about birth control and the exposure that might have. And that also gets into the water and everything, and even just high blood sugar. Some of this stuff can mess with the estrogen system.
Yeah. That's so interesting. You're doing great.
Thank you.
And that's
I'm trying to get a TED Talk.
I know.
All at the same time.
Look, you're doing it all. We only have one more, okay? And last one.
This is your podcast and workout at home, so.
Look, we're making the most of our time here, so just make sure that's safely to the side. And then we're gonna go into 10 squat jumps or squat to toes, whatever is feeling good for your body today. We're gonna reach back and then softly land, descending into that next squat. We're halfway. 8, 9, and 10. Good. Okay. Whew. Shake that out. Grab some water. I know I'm gonna grab some right here. Do you have your water?
Yeah.
Okay. Good.
But to finish that point really quick, the elephant in the room on so much of it is environment, stress, like all of the American stuff now, and all of that disrupts these systems too. And then you just end up in kind of this total dysfunction.
Yeah.
And women are unfortunately just higher risk. So it's a whole thing, but diagnosing, treating, all that, we just need to improve.
It's so wild to hear that. And it's so tough because like I historically was a kind of person who would go a little bit over the top. Mm-hmm. And long story short, I used to have an eating disorder, treatment, recovery, all the things. And so now in my life, I'm very much like, I want to be healthy and I don't want to stress myself out too much by trying to be perfect. Mm-hmm. And so when I hear like environmental things and stress and all that, I think my wiring tends to be like, well, if I'm stressed, then I'm gonna get sick. If I get sick, then this isn't good. And so it's like, how do I like unwind that so that it's like, girl, you're fine?
It's so major in the hustle culture.
Yes,
like,
I know.
We can always keep going. There's always more you could do. Work is like always around the corner.
Yeah.
So
let's hit one more round of this. And let's hit it. Yeah.
One thing I've realized with this is, do you know about fight or flight and rest and digest?
Tell me all of the things.
Sympathetic, parasympathetic. So there's these two systems in your body that are in balance. The fight and flight and the rest and digest. You might hear about vagal nerve is over on the rest and digest. And then the sympathetic system on the fight or flight.
5 more seconds. Yeah. You're doing great.
Which one thing I'm realizing when you're working out and double activating the fight or flight.
And stand.
It wears you out quicker.
It does, right?
Yeah, but that whole system, we tend to live like 75% over in fight or flight zone.
Really?
I think so, and you kind of get locked into that way of life and it's hard to balance out.
Let's hit our 10 reps. Man, that's
ready?
So interesting. 70% in fight or flight, what should we be?
I mean, ideally like 50-50, I would say. It depends. The fight or flight system was built to escape threats.
Yeah.
So, you shouldn't be getting chased by a lion 80% of your day. So who knows?
Nobody
That's an interesting
wants that.
question. Yeah.
We have 2 more right here. 9 and 10.
I feel like this is a different version of Hot Ones.
Yes. That's a great point.
Yeah,
just like the longer we go, the harder the workout's gonna be. And I'm gonna keep asking you questions. Yeah. 100%. And the hardest part here, we're gonna get into our squat jumps.
Okay.
2 and 1. Nice load. Softly land. Good. Halfway. 2 more. Good. Okay. Break. Grab some water at home. Feel free to pause the video if you need a little extra time. We're gonna go into our upper body push set. So from here, I would say grab some light to moderate dumbbells. We're gonna be going back to back to back here with 3 exercises, so the volume will add up. So I wanna just make sure, start a little bit lighter than you think you can go, because I wanna make sure that you feel nice and safe at home. So I'm gonna start here.
20s?
Yeah, yours are there.
Okay.
Okay. So I'm gonna get us into the set, and then we'll get it going here. So I'll scooch over here a little bit. Right. So we're gonna go 3 exercises back to back. The first one we're gonna do is a skull crusher, and we wanna do the opposite of that. We don't wanna actually crush our skull. It just is the name of the exercise. You have a firm grip on the dumbbells. Keeping the arms about shoulder width apart, keeping your elbows pinned in place. You're going to slowly lower the dumbbells towards the ground and then push them back to the start, okay? So let's do one more demo. And that is our first exercise. Second exercise, you're gonna put the ends of the dumbbell together, pressing them together. Again, firm grip on the dumbbell. You're going to turn the dumbbells towards each other as you lower them down towards your chest, keeping them pressed together, and then push them back to the start for a fold-in press. Okay, we'll do one more demo right here. Trying to keep the wrists as straight as possible and keeping the dumbbells touching the whole time. Okay, then last one, we're gonna go a classic traditional chest press. So we're gonna keep that firm grip, lower the dumbbells about 45-degree angles so you look like an arrow at the top, and then push the dumbbells back to the starting position, and we'll be there. We're gonna go 8-8-8.
8-8-8.
8-8-8, okay. You ready?
I think so.
Okay, so we're gonna start with our skull crushers here. In 2 and 1. So we were talking about a lot of different things when you first walked in, and I feel like I'm gonna run out of time, so you'll probably need to be a buddy again.
Okay, I'm down.
Because I think women's health, that whole conversation is super interesting.
That's a huge one, and just as a caveat, like, we're totally not doing it justice, but I hope this even opens the door for people to, like, that haven't heard some of these things.
Yeah.
To look into it.
And that's the kind of thing too, where sometimes if people are experiencing, give me 2 more here, some sort of symptom, they don't know where to start, you know?
This is,
Good.
Speaking of this sort of forum, like podcast.
Yeah.
Are we going in there?
We're gonna go into the fold-in press.
Okay.
And so we'll stay here and then fold the dumbbells in, firm grip on the dumbbell, trying to keep the wrist as straight as possible, move it towards your chest and press back out. Good. Keep it going here. Okay.
Luckily, I think information is getting out there now, though.
Yeah.
Like, you're a part of it with the podcast environment and everything, and people are accessing it.
Yeah.
And this is making so much reform happen that probably would have taken so long otherwise. Yeah, I see it in the medical system for sure. It just has to make its way finally to insurance and everything, but people are testing, people are using their own bodies, right? I'm sure you have with biohacking or any of that.
One more.
I'd be interested in your journey a little bit. Did you have any landmark moments that made like a big change for you? Yeah,
like in my overall health or in my recovery or?
Yeah, was there like a diet or a moment when?
Well, let's hit these 8 chest press. I think for me, like, I wanted to be just a healthy person. I was an athlete, and so I wanted to get more playing time in college. And so my whole thing started because I wanted to be as healthy as possible. And then it quickly spiraled into disorder, just like the perfect storm of things.
Right.
And then after that, I think I just realized, I don't know what it was. I think that my desire to feel like myself again and having glimpses, give me one more here, and break. Remembering who I was and being like, having quick little like glimpses of those feelings again made me be like, okay, I need to figure out what health actually is and not what my brain is telling me, because I always was able to trust myself. I'm type A, rule follower, whatever.
Say you had the perfectionist thing.
Yes, and I realized like, okay, that's good, but it's too far here.
Right.
And so I need to figure out how to dial that back.
Balance.
Yeah. So I think just through that process, it was kind of like a trial and error, being like, okay, I think certain health things are for me.
Yes.
Some things are not for me. I'm never gonna be a person that does like a 5-day fast or like something like that. You know what I mean? It's just, maybe that's for some people, but I know the boundaries that feel right for me.
Yeah, that's that body aware thing.
Yeah.
Like, it sounds like you super have that in tune now, and sometimes you venture off the path, I think. And you know when it's too, that's when you learn, and you're like, whoa, I'm way off. You come back around. Some people, I think, get stuck. We see a lot of like depression, anxiety.
Really?
I give people the benefit of the doubt that this is something, your body doesn't want to be depressed or anxious or any of this stuff. It's usually something else going on.
Interesting.
most of it's either like a gut imbalance or all these sorts of things. And if you can fix that, I think the body's always trying to heal. It's usually environment or something else, so.
That's wild. So if people are getting therapy and all the things, you're looking at from like a biological perspective, like what can we, that's so fascinating.
Right, root cause usually, because people, they'll tell you like, I just can't get the engine going. I'm like, you know what if I actually believe you? And we,
wow, that's refreshing.
Yeah.
Okay, so someone comes in and what are you gonna tell them? They need a certain test first? Let's go into our skull crushes.
I'll give you an interesting one that kind of paints the picture of how these things can play out. So I had a guy come in the other day, and he was totally a neck pain case.
Neck pain.
Neck pain.
Okay.
And I see a lot of spine people. So this was right down my alley. I shot some x-rays, we're doing ultrasounds. This guy's joints look perfect. He feels pretty good. The only complaint is his neck is like really stiff and it gets inflamed and he was getting migraines. And then I find out he recently had like a sinus surgery and that helped a little bit, but it's still there.
Okay.
So all this stuff, someone would just say, you're fine, whatever.
Yeah.
We find out, we do mold testing on this guy. This is 100% a mold case. And anyone that's had mold exposure knows it's this tight, aching, just thing.
What?
A lot of the time in your neck.
That's unreal. Fold and press 8.
So we test mold on him. We start detoxing mold, put him on binders, pulling everything out. This guy realizes he's just had years of brain fog, didn't even realize what clarity was. What? All of it, like this veil's coming off, his neck pain's resolving. He was 100% a mold case the whole time.
That is unbelievable. And like, obviously so horrible that he had to go through that. We have one more.
Right.
But like, what a amazing thing to discover that. Quick break before we get our chest press. So what is that treatment plan?
It's different so you can kind of attack things in different ways depending on what it is. There's usually more aggressive, which is like for mold, you can use things like fluconazole, itraconazole, or amphotericin B or really strong antifungals, but a lot of people, you don't need that. Mold, most of the time, is just you're getting exposed to the things it makes called mycotoxins.
Okay.
And if it's just that, you remove the exposure and then you can usually bind them out of the system or they'll get eliminated in time, and that's enough. But molds can also form things called biofilms, where they kind of make a little colony and produce spores. And then there you have to clear them out a little more aggressively with like rinses, or they can do that in your gut too. So it's a deep dive, but like Florida, Texas, humid areas, mold, think about mold. The mold is like a huge one.
That's unbelievable.
It's crazy.
Because we're gonna move these to the side for our finisher. We're something like, I work with people in the sense of like, we're focusing on the basics. We're trying to move our bodies regularly. We're trying to just move, right? We're trying to get stronger. We're trying to make more mindful choices with nutrition. And sometimes people are doing all of these things. They're getting sleep, they're trying to get out of fight or flight. But then there's still other things where they're like, what is happening? I'm doing all of this stuff. And that's where it's like, Jeff, take it.
We're there for that. I mean, you should be able to be active. You should be like happy on a daily basis. If the systems are open, think about when you were a kid, like it was all coming easy to you. And as we get older, like we kind of forget what that was, and the health is a little down here. And when you're like optimized and you're doing your thing, like you feel pretty great and you can work out. Exercise is a tough one because sometimes your body's so exhausted, then you start stacking exercise, it's just not there. But like if you can at least get a little momentum, then the exercise is one of your best medicines.
Isn't that so interesting? I'm gonna save that thought for when I get us into this. So our finisher, we're gonna start here. You're hovering. Now if hovering is too much, you can go and rest your knee, but we're gonna hover here and we're gonna go calf raise, okay? So we're gonna go for time. Ready?
That's just mean, isn't it?
I know, it's rude. Okay, and hit it. So here, shoot, what was my thought now? I was like, wait, we're gonna stop.
I'm thinking heel toe, heel toe.
Yep, that's all I'm thinking about. Oh shoot, what was my point on that? We have 5 more seconds. 3, 2, 1, and switch.
We were talking about exercise, being capable of it, having the energy for it.
Oh yeah. So what I have come to in my life, and hit it, is like making it a habit instead of perfectly checking every single box off on my planned workout days. Like, to your point,
like that.
Like, there are times when I know I had a workout planned, but maybe I'm like at a certain place in my cycle where we have 3, 2, 1, good. And we're gonna come to the floor.
This one's tough, okay.
I know, and then this one. So we're gonna go on this side, we're gonna go plank to push up.
Okay.
We're gonna go 5 on each side.
Oh, I love it.
Okay? And let's hit it. Yeah, so for me, I try to just be as consistent as possible. But I think sometimes, to your point, where it's, if someone is never feeling like working out, like they constantly feel brain fog, that's different. 1 more on this side, and then we'll switch. 1. Good job. This one's tough.
So what do you do on those days? Do you ever have days you come in and then you just tap out and it's a day walking on incline? Something like that? Or?
Yeah, honestly, like, I feel it's interesting because a lot of people think to be successful, they need to feel intrinsically motivated. They need to feel like, I feel like I'm working out all the time and I need to feel excited about it.
Right.
I go through a lot of phases where I don't feel excited about training, but I know if I haven't worked out or moved very much for 3 days, I'm gonna go to the gym and do a super basic workout. I'm gonna do a push, a pull, upper, lower body.
Oh, I love it.
And I'm not gonna try and PR, I'm just gonna move. Or I'll, like you said, an incline walk. Like I'll just walk on the treadmill, I'll take my dogs for an extra spin. Like, it's not that I need to, I want to be as strong as I can, but I'm at the phase of my life where like, who am I trying to impress? Like, I just want to feel good for as long as possible.
Totally, I love that one. Yeah. Walking is the best ever.
Yeah.
I will go
Tell me
on about this forever.
Let's do 1 more set of this and then we're done. We're gonna do 20 seconds on each side.
Okay. Well, one thing to mention, I think a big one is just how joints actually, the test of concentration.
I know, right?
Is all of your joints are very avascular, meaning they don't get incredible blood flow. So people have probably heard about like cartilage. Once it's gone, you get minimal blood flow. All these things that's not as talked about is they kind of breathe like a pump.
Okay.
So when we're doing this in our foot right now, in that joint space, we're going, and you're pulling in blood and you're pushing out blood. And the same thing in the knee, if you're walking, bending, push, pull, spine, that bounce. That's how it breathes. This is like the best thing. This is the motion, this lotion, all of that sort of theory.
So if people are trying to be healthy, what's the one thing they should focus on with their movement?
I think not getting stiff and stagnant. It's the worst thing. People say sitting is the new smoking. Yeah. That one's totally true. Yeah. All these stagnant positions are the biggest one. So first, before you can train, you gotta get a little bit flexible. We gotta open the joints. You did that today. Yeah. Then it's these basic movements. And I wouldn't be ashamed if you can't pump the weights. The bigger thing is that motion at the end of the day.
I love that so much. We're gonna go 5 each side. So we're gonna start pushing our right hand only in, and then we'll go to the left.
Oh, each side, okay.
Yeah, so we'll isolate 1, yep, and then down, and then right, yep, down, yeah. 3.
There it is.
4, 5, back down, left hand, push, and down, yep.
So we added a mental component.
I know, right? Yeah. And tell me about all these scientific things that you're doing.
Exactly. And do this Rubik's Cube.
Right? And done, that's it. Well done.
Buddy.
Buddies at home, excellent job. This was so fun. I feel like there are can you come back and be a buddy again?
Oh, we definitely should.
Like,
I would love it.
Yeah, I feel like, because I want to talk, you have so many specialties in spine health. We talked a little bit about women's health. You mentioned like peptides and things. I have so many questions about that.
Yep.
So I'd love to learn more, and I know our buddies at home would love to learn more about that too.
Yeah. For everyone there, it's getting from over here to normal, and then everyone we want to graduate from normal to optimized and exceeding. So that's the goal.
And I think the beautiful thing about what you've talked about is people listening to their bodies and you listening to people and then figuring out a solution, because something that can be so discouraging when you're not feeling well, when you feel like you're underperforming or your body just doesn't feel right, like you feel off, it can feel discouraging to be like, will I ever feel like myself again? But from what I hear you saying,
totally,
you can feel better and you can feel optimized.
Yeah. Like it's lifestyle. This one gets ignored. We go straight to the top of the pyramid. It's lifestyle, nutrition, this sort of stuff. Supplements if we need them. Then come in our, peptides or stem cells or whatever else we do. And then the top is like surgery and drugs. This is like last resort. And we skip all the rest of that pyramid.
That is so incredible.
Yeah. Wow.
Well, we have options.
This was an incredible workout.
Yay, I'm so glad. We're both like sweating. Well, we can't turn on the air conditioning for the audio, so that's what it is. Okay, so where can people find you? Do you take patients here in Los Angeles?
We do.
What is that process?
We see people as best we can. It's a relatively small concierge practice, but I'm super open to talking to really anyone. The practice is called Bio Reset. You can email front desk at bioresetmedical.com. Instagram, just Jeff Wiegers. You can look me up on there. I'm gonna post more. I'm gonna try to do more of this. So thank you for having me.
Oh, thank you. You're a wealth of knowledge, and I'm excited to keep getting to know you and keep learning from you, because I feel like there's so much that I want to learn, and I know that everyone at home will benefit from that as well. So thank you
It's a journey.
so much for being here.
Thank you. Yeah.
All right, everybody, thank you so much for joining us today. Make sure you like this video. If you had fun today, make sure you subscribe to our channel, because we post not daily workouts. That's coming. We post weekly workouts here on YouTube for you, and we have something in the works that's gonna give you daily workouts, and I cannot wait to share that with you. It's coming so soon. So leave us a comment. Let us know how that workout went for you. If you have any questions for Jeff, feel free to leave them. Make sure you go follow him on Instagram, find him all the places, give him some love. So thank you so much, everybody, for joining, and we'll see you next time.